Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody. My poster presentation today is titled HIV and Marital Deception, the complex story of HIV transmission among women in South Sumatra, Indonesia. Introduce myself, Najma, and my partners, Sari Antajani, Sharon Graham Davis, Tom Graham Davis. Today's presentations will consist of abstract, project rationale, methods, results, and then finally conclusion and suggestions. The abstract case today is what we want to introduce, that the study aims to challenge the misconception and investigate the complexity of HIV transmission with a focus of HIV susceptibility among married women in Indonesia. Feminist-participatory Action Research was conducted in 2017 and 2021 with 21 women with HIV in Palembang, South Sumatra, Indonesia. A combination of interview, focus group discussion, graphic analysis, and auto-ethnography was employed to assess the impact of the actions of women and men who partake in high-risk behaviors and pass HIV on their spouses. This article provides an original contribution to the concept of marital deceptions, married women's vulnerability to HIV. To address this issue, we argue that Indonesia needs a higher level of health and HIV literacy, as well as open discussion of sexual practice which challenge deeply held social convention regarding sexuality, marriage, and the role of gender that plays in supporting damaging behaviors and HIV. Firstly, the problem statements. Over the last decade in Indonesia, the data shows that the largest group of new HIV cases is women of reproductive age between 15 to 49 years old, and at least 40% of the are women. This trend is underpinned by the broadly held and the fallacious belief that heterosexual married women are not at risk of HIV. This study aims to challenge the misconception and investigate the complexity of HIV transmissions, and we mainly focus on the married women in South Sumatra, Indonesia. So we hope that this presentation will provide original a contribution to the concept of marital deceptions, and women were aware that every woman is at risk of HIV transmissions. This is the meta-sweat that we were conducted, that Feminist-participatory Action Research was conducted in between 2017 and 2021 with 21 women with HIV in Palembang, South Sumatra. So we conducted in following years for the research, and we conducted combinations of focus group discussions, interview, and also informal interviews, and as well as in the COVID pandemic, we conducted an online interview with the participants. For the data analysis, we conducted the thematic analysis to note the themes that come out from the participants' experience, voice, and the interviews results. The first result that when we see from the characteristic of participants that 10 of them work in informal sectors and 19 of them identified themselves as ibu rumah tangga or housewife, or women just stay at home and take care of their family and children. And 4 of the women in this study raised HIV positive children because they knew their HIV is very late, for instance, after the husband sick or this husband passed away. And 13 of them is married women, and 6 of 13 participants were in the second married. And the results that we want to show, the HIV vulnerability in Indonesia is so complex. So as we know that in the most cases that It is the male partners who contract HIV through these behaviors, high-risk behaviors such as being injecting drug use or having unsafe sex with the man. And sadly, they pass it into their wives or partners, often with his knowledge, sometimes without the knowledge of the husbands. Married men may have affairs or polygamously married to other women, either it registered or unregistered marriage, without the first wife's knowledge or consent. Furthermore, men who are bisexual or homosexual face pressures to get married to women and may contract HIV through hidden unsafe with other men. So when you see the complexity from these pictures, that the victim is on the children who don't know anything, and the children or the newborn baby may get infected HIV from the mothers because the mothers may not be aware of the HIV status. The next result, that what the factors that behind this complexity, that we mapping that there are four main themes that we need to know. That firstly, the shame and taboo to talk about HIV, to talk about sexual outside marriage, and secondly, the hidden polygamy and the risk of HIV. Thirdly, that the femininity, the non-sexual disclosure of sexual history. For instance, the husband may have the unsafe sexual behaviors with another man or woman before their marriage. And lastly, the reflections of marital deception among women living with HIV. The shame and taboo. Based on the Sharon Graham Davis, that the shame is visited on through the bodies of the woman far more than men. Women are conceived as being the primary symbols of their family's shame. As such, a woman's behavior is closely monitored, so she does not threaten her family's social standing. So beyond the woman controls that how the HIV seems to be a taboo topic, and religiously bonded economic slavery, that we being a woman, and HIV positive women tend to be remain silent and accept their HIV status as the God destiny to provide their souls and to reduce their sins. So it's challenging to talk about the HIV, although they already got infected HIV, because there's shame and taboo. And interestingly, the hidden polygamy and the risk of HIV. Secret polygamy is widespread in Indonesia. So there is a hidden marriage or unregistered marriage, because in heterosexual relationship in Indonesia, we aware that monogamy is promoted through the regulations of Indonesia. So if the men want to have another wife, they tend to secret or hidden marriage. And sadly, that women are vulnerable to HIV regardless of their social economic status. So the rich woman can get infected HIV, and the poor woman also can get HIV based on our study. And sadly, that the marital and sexual deception is interesting point that we want to emphasize on these presentations, because the marital deception is a complex phenomenon involving different spheres of women's social life, interpersonal relationship, and family. So it's rooted the social construct of gender norms and bolstered by state ideology in Indonesia context. Marital deception refers to any act of betrayals, dishonesty, and manipulation within marriage. And marital deceptions also intersect with wider social, cultural, and religious factors. And what we want to conclude, that the articles provides the original contribution that to the practice of marital deception and marriage a woman's vulnerability to HIV in Indonesia. HIV rates among of reproductive age in Indonesia are climbing due to the following factors. Firstly, married women are considered by the Indonesian government and policymakers to be at low risk of being infected HIV, as it is assumed that married men do not have sex outside marriage and therefore cannot transmit HIV to their wives. And secondly, that a second factor is the shame associated with contracted HIV. If a husband knows or suspects he has HIV, he may deny it, thus making his wife highly susceptible to contracting the disease. The shame associated with HIV means that discussion about HIV are deeply disturbing to Indonesians. And lastly, that even when there is an acknowledgement of HIV, the lack of open discussion of HIV means that people may have very little knowledge of it. The hostility to open discussion of HIV is exacerbated by limited HIV screening of pregnant women and unintegrated health services, meaning that there is a little support available, resulting in many women unknowingly transmitted HIV to their babies, because not all pregnant women access to public health centers which provide free HIV tests, and not all pregnant women who knew their HIV status will go to the next health services to access the program called that Prevention's Mother to Child of HIV Transmission Program in other hospitals. So in order to reduce the risk of mothers contracting HIV and transmitting HIV to their children, and to enhance women's early access to prevention's model to child of HIV transmission services, health services providers need to aware of and address gender discriminatory factors in the training and policies. Thank you very much, the Week of Indonesian Nadala Education and Research. I hope we can have more collaborations in the future. Thank you.